Hello everyone, this is Dr. Amit Mishra here. I'm a practicing orthopedic surgeon practicing from Andheri to Borivali. I have specialized, I've done my MS and in my DNB. I've done my further fellowship studies in Hinduja and even at Konkuk, Seoul. So I'm specializing in hip and knee, where my special interest lies in arthroplasty, arthroscopy, and also I deal with complex trauma as well. I've been practicing for almost 10 years now, like I said, in the suburbs of Mumbai. Musculoskeletal health plays a key role to keep up the good mobility and agility in an individual. Okay, it also enhances its ability to work and actively participate in all aspects of life. So, good musculoskeletal health is also crucial to maintain good social, economic, and functional independence across their life course. Physical activity plays a main role in reducing the risk of non-communicable diseases, and it can be only achieved with adequate musculoskeletal health. Impaired musculoskeletal health can lead to acute and chronic pain, causing physical limitation, proceeding in loss of participation and withdrawal from usual social community, and more and mainly, it also causes a lot of mental health issues in especially elderly gentlemen. So impaired muscle health can lead to substantial personal, community, social, and mental consequences, particularly in older people. So there is a strong relationship between painful musculoskeletal conditions, lack of physical activity, resulting in a physical decline, frailty, loss of well-being, and loss of independence, as well as depressive symptoms. An individual with arthritis and musculoskeletal disorders is sure to be less active than an individual who doesn't have arthritis. This goes without saying. So more importantly, impaired musculoskeletal health causes reduced physical activities like grip strength, walking speed reduces, the ability raise up from the chair, stand up, getting up, walking is going to reduce, the standing balance is going to falter. These are all linked to increased morbidity. Hence, a weak musculoskeletal health is a key component of frailty. So what is the impact of musculoskeletal now which is globally recognized and with an increased morbidity and mortality related to it. So a good musculoskeletal health is crucial for maintaining an active and productive, and a prolonged working lifestyle. With increase in global retirement age and lifespan, maintaining good musculoskeletal health is the key now. Developed countries, there are more older workers who have many occupations and have work-related activities. Now, with increasing age, now we have seen that there are a lot of back problems, knee problems, shoulder issues, and they all lead to and implement there. This is important to identify and implement effective interventions for people with musculoskeletal conditions to remain productive in work. Like I said, the developed countries, because of these conditions, there is loss of work, early retirement. But mainly in developing countries like ours, it has a major impact on the livelihoods of people. Hence, reduced musculoskeletal health, impairs their livelihood. Since musculoskeletal conditions are chronic, painful, associated with disability, social disengagement, and frequently causes mental health problems as well. Non-communicable diseases now account for most of the global burden with musculoskeletal condition, which has become the leading contributor. So developed countries well recognize the transition of burden of long-term disability conditions. However, now in low and middle economic countries also demonstrate enormous future impact over the musculoskeletal health, such as osteoporosis, back pain, which is driven by population growth and aging. Since age remains one of the most common risk factors, since age remains one of the most common risk factors for musculoskeletal conditions, it is estimated that by 2050, there will be 5 times as many people over 40 living in these developed countries. Additionally, obesity is also another risk factor which goes on without saying. So increased use of motor vehicles, sedentary lifestyles, reducing physical activity also increases all these problems. Increased motor vehicles leads to increased motor vehicle accidents, and more resulting in more musculoskeletal trauma and disorders. So sustained and systematic urbanization in developed countries has led to sedentary behavior among people, especially younger ones. So there is a rapid growth of lesions like video games, social media, with Twitter and Instagram coming into account, OTT platforms, movie streaming, binge watching has been the prime contributors. This surge in sedentary behavior is only at a major risk contributor to many chronic diseases, which is also recognized globally. Increasing physical activity and optimizing health or exercises as recommended by the arthritis research and also by WHO is an optimal way of improving musculoskeletal health. Evidence shows that effects of sedentary lifestyle can be reduced by small amount of activity every day. A recent meta-analysis utilizing the data of over 1 million people concluded that 1 hour of moderate level of daily activity can reduce the increased risk of death, which is associated by 8 hours of sitting, which now in our COVID times, everybody is used to with work from home periods. So they are all used to increased level of sitting. Thus, a moderate level of physical activity remains a key requirement in our life nowadays. Sedentary lifestyle also is a major contributor to obesity and type 2 diabetes. Likewise, obesity is also a major contributor to the development and progression of osteoarthritis, with several epidemiological studies also confirming that. Evidence suggests that increased levels of physical activity will not only improve their musculoskeletal health, but also decrease the risk of suffering because of obesity and other cardiac and respiratory illnesses. So now what do the WHO recommend? Nearly 2 hours per week of moderate physical activity or about 20 minutes per day of any kind of physical activity like brisk walking is usually recommended by the WHO. These exercises elevate the heart rate and are known to associated with lower lifetime risk of cardiovascular diseases. Apart from rendering, just musculoskeletal health, we are also looking into the cardiorespiratory fitness, which can be achieved by changing our sedentary behavior to low intensity of physical activity like walking. Even in post surgeries nowadays, early mobilization is being the key. So after trauma, after knee replacements, after hip replacements, after any kind of surgery, the key motive of all our surgeons nowadays is early mobilization. So any kind of physical activity will help in determine in better well-being of the patient, increase in a good outcome as well. Exercise has now been prescribed for rehabilitation of musculoskeletal injuries, and it is used as a preventive health measure, which is now been widely investigated with guidelines around the type, frequency, and what duration of activities needs to be considered. Low back pain and neck pain can be benefited by staying active and exercising regularly. Group exercises or weight loss support can also be considered. To reduce the incidence of falls, balance and strength training are very important. Participation in fall prevention programs and getting involved in activities like gardening and small activities of their daily, going down to the garden, getting used to a laughter club will all enhance their social and their mental well-being in higher individuals, all the older people. Osteoarthritis has been shown to be benefited from activities and exercises and can also improve muscle and aerobic fitness like walking, swimming, Pilates, weight loss support can also be rendered if required. Osteoarthritis has been shown to be benefited from activities and exercise that improve muscles, and aerobic fitnesses like walking, swimming, Pilates, weight loss support program can be rendered. Aging is inescapable, can be made easy and healthy with the help of exercise. So exercises renders many benefits to the aging body, including reducing the manifestations of aging, especially the aging phenotype of the elderly. A recent systematic review concluded that physical exercise renders a positive impact on muscle mass and function in healthy individuals aged 60 and above. By improving muscle performance, it also improves by increasing the ratio of type 1 to type 2 muscle fibers and increasing the core sectional area to type 2 muscle fibers. The European Society of Clinical and Economic Aspects of Osteoporosis recommend higher intake of protein in combination with physical exercises in postmenopausal women. So physical exercises program improves strength and balance in aging women with osteoporosis. Fragility risk factors associated with osteoporosis can also be decreased by following a proper exercise program. It also improves the bone density and helps in reducing the inflammatory markers. Thus, having an active lifestyle form at an early age and considering the recommendations for exercises could be really beneficial for women. Furthermore, exercise and mechanical loading also have a positive impact at the molecular, cellular, and tissue levels. Likewise, with aging, the potential for cell proliferation and the number of stem progenitor like cells helps in reducing decrease in tendons. Like with aging, the potential for cell proliferation and the number of stem progenitor like cells decreases in tendons, muscles, and cartilage. Hence, exercise loading can induce an increase in tendon collagen synthesis, increasing the tendon strength. Physical exercise and mechanical loading also have a positive role in maintaining cartilage and bone health. Moderate exercises could also enhance the quality of tissue produced during the healing of injured tendons. A surge in sedentary behavior and unhealthy diets have caused a global obesity epidemic, along with sharp rise in the incidence of type 2 diabetes. This leads to further risk factors of cardiorespiratory or cardiovascular or neurodegenerative problems, which can further deteriorate musculoskeletal health. So obesity is an important comorbidity of many musculoskeletal conditions, and it is closely related to the development of osteoarthritis, one of the most common musculoskeletal disorders. Thus, strategies aimed at reducing obesity in adults will reduce the occurrence of osteoarthritis and thus also help them in the pain due to the condition. Interestingly, obesity is also one of the most modifiable risk factors. Exercise and weight loss have always benefited overweight and obese individuals with people suffering from osteoarthritis. Thus, moderate amount of weight loss with moderate exercises is usually the best overall program dedicated to such individuals. Lack of physical exercises in childhood causes childhood obesity, which further leads to more musculoskeletal issues. Thus, reducing obesity in children by increasing physical activity will also reduce the risk of developing musculoskeletal pain at a later date. Furthermore, consumption of unhealthy diet and sedentary lifestyle is contributing to increased incidence of childhood obesity. Low in nutritional value and high in calorie content foods further contributes to obesity epidemic, which also may play a big role in the high prevalence of musculoskeletal disorders. Diet is an important part of healthy living. A 3-year follow-up study of about 400 adults have showed that diets high in potassium from fruit and vegetable intake reduce the amount of muscle mass loss in adults more than 65 years. Dietary flavonoid intake from fruit and vegetables is also known to be positively correlated with good bone health. It also helps in improving good bone mineral density and reduces the bone resorption in perimenopausal women. So improving a diet in OA patients have shown great benefits. Vitamin D, calcium, and particularly protein consumption has shown to optimize muscle health, including bone and cartilage as well. So calcium and protein synergistically optimize the bone health. Thus, dietary strategies for improving musculoskeletal health should include consumption of long-chain fatty acids, vitamin D, vitamin K, good amounts of calcium, and some amount of moderate exercise needs to get along with that. Antioxidant-rich diet may benefit athletes by improving their tissue repair. Sarcopenia in elderly people can be benefited by combining exercise with dietary supplement of whey protein fortified with vitamin D, as it increases muscle mass and strength.